Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello, everybody. I'm Dr. Mary Ann Pinkston, and welcome to The Better Life with Dr. Pinkston. I am excited to be alone at the mic today and to talk a little bit more about some medical problems that I think my patients suffer from. But, the interesting thing is whenever you have a problem that doesn't really fit the bill of your contemporary medical doctor. I know these days people go to their nurse practitioner, their physician assistant, their provider or their doctor, and they have a complaint. And most of the times things are written off as, here's a pill. This is what it is. You fit this algorithm. You fit this recipe. You spend, 5 or 10 minutes maybe with somebody who's looking at a computer and they want to just write you off and give you a prescription. So I want to give you some thoughts as to how you can overcome that and get some better work for your money and what you're doing, your insurance and everything, and learn how to loophole around those things. One of the things that I find patients suffer from that they don't honestly get the help for is peripheral artery disease or peripheral venous disease. Okay, so, this is something that is blown off widely by contemporary physicians. I had this, and this is why I want to talk to you about it, is I had this, and I was amazed at how much getting treatment helped. So at one point, I was 300 pounds. And I had, that's a lot of pressure on your lower extremities. So people think about being overweight, that it hurts their joints mainly, but there's something else that can hurt, and that is your veins and your arteries. So if you look at the human body, you've got the heart that, pumps blood into a large pipe called your aorta into your artery system, and that goes throughout the body all the way down to your feet. And then the blood must come up, and it has to go up against gravity. So your venous system is what brings the blood back up, and it goes through little channels or little doors that open and close to keep pushing it forward and keep pushing it up towards the heart against gravity. When you are overweight, or as you're getting older, maybe if you lift at your job, carry a lot of heavy things, there's a lot of different ways that this occurs. But those little valves that help to push up the fluid in the veins actually will fail. And so blood will try to go up, and then it pulls back down and stays in pools in your tissues and in your legs and your feet. So if you look and see, a lot of people complain about having some swelling in their feet. You've been sitting for a long time, you've been on a plane and a car ride, or just on your feet all day. Nurses, doctors, people are on their feet all day. Well, notice that by the end of the day, their feet are swelling. This is your venous system that is doing this. A lot of people blame their heart. Congestive heart failure is a reason why this happens, but the venous system is something you need to start paying attention to. Now, if you don't, what happens? You think, well, my feet just swell. I'll either wear some compression socks, or I'll get off my feet, lift my feet up, elevate, and the swelling comes down in the morning and I'm fine. What happens over a long period of time is that fluid starts to stay in your extremities, and there are toxins and there are acids and there are things that, need to be cleared and moved into your system and cleared up by your liver and your kidneys and gone from the body. When that fluid stays there, when those toxins and all those things stay behind, over time you get to, having aching of your limbs. You get restless legs at night. So if you're sleeping and you feel kind of creepy, crawly ant feeling, you just can't sit still. If you're in a, car or a plane, you need to get up and walk. You just can't sit still. That's restless leg. Or go into neuropathy. So many people have heard about peripheral neuropathy, where enough swelling occurs in the legs, or, enough toxins or irritations start to affect the small, fine nerves in the feet. So you get a burning and a stinging or an itching. Many people at night will have to uncover their feet or take their socks off, because just the blanket touching their feet will cause a lot of burning and stinging. It happens at night mostly because you're quiet and you're laying there and your nerves are on fire and you can finally pay some attention to it rather than being up during the day. So it happens mostly at night. There's also just leg aching. A lot of people will take magnesium or, try some lotions and things. But when your legs are miserable like that and swollen, then you just need to start looking at peripheral artery disease. Now, I'll tell you a story too. I had a lady who I've been seeing for 20 years. She's had type 1 diabetes. She's been on insulin for a long time. One of the problems with diabetes long term is that it kills those little fine nerve endings in the feet and the hands and other areas behind the eye, your kidneys. And so there's a string of problems that can come from that. But neuropathy, when it affects the nerves and it causes that burning and stinging, a lot of doctors feel that there's just nothing you can do at that point. Many patients will go on pain medication. They'll go on Lyrica. They'll go on gabapentin. They'll go on, nighttime medicines, nortriptyline, amitriptyline, if you've heard of any of these. There's a lot of different medications that we try to give people to help with that pain, as well as getting their sugars under control. But I have found, and this lady who I've seen for 20 years had developed neuropathy, every physician, even her foot doctor, her neurologist, everybody blamed it on peripheral neuropathy from the high blood sugars causing damage to the nerves. I told her, I said, let's try something. I'm going to send you over to one of the there's 2 great vein places. There's actually more than that, but there's 2 great vein places that I use here in town, Stride Care and Medical Vein Clinic. And let's send you over there and have them take a look and see what's going on with your legs. See if I can help a little bit with this. She went to this place. She got the ultrasounds and the easy testing. It's painless testing. You get an ultrasound. They look at those veins to see if they're functioning and moving fluid up well. And they said she had very severe peripheral venous disease. So they worked to fix that within, it took a couple of months, and it really is not painful. I had this done and I did not find it to be painful, but I had this fixed, and she came back within a couple of months and said, my neuropathy is gone. Not just better, folks. Gone. And the whole time we've been blaming her diabetes, which I'm sure is part of it, but to get her veins fixed, that neuropathy went away. So I'm not promising that that's always the cause, but that is a cause that really needs to be looked at, and that's something you need to be thinking about. So restless leg and the aching calves, aching feet, that burning, stinging itchiness and numbness that can come with it, those are some of the symptoms that you can have. Now, if you don't pay attention to it even further than this, let's say you're living with the restless legs, you're living with all this discomfort, and you don't pay attention to it, what can happen? So as this fluid pools in the legs, as you can't get the fluid back up to the heart and circulate around the body, as you begin to experience this now on a permanent basis, the legs begin to develop ulcers. So you get a decay. It was what kind of the top of the skin basically is not getting good blood flow, and it begins to decay and weep and open up. These ulcers, especially in diabetics, can lead to having an amputation. So you go on antibiotics and you get lots of surgeries and skin grafts, and there are all sorts of problems. And because of all this, the antibiotics can't get to the tissue well because it's full of fluid, and the compression socks are no longer working, and all these things that, docs are trying to do because of the circulation is no longer going to work, and nothing will help to heal it. So eventually, if it becomes infected, goes down to the bone, you've got to remove a toe, you've got to remove a foot, you've got to remove a leg. And that is when you're experiencing the most severe of peripheral venous disease. If you are able to, go to your physician and ask. If your physician tells you that this is just a neuropathy, take this supplement, take this pill, ask them. You are in charge of your care. You are your own advocate. Sit down, ask your doctor, could this be peripheral venous disease? Is this something that maybe I can go to a vein doctor and get checked? And, your insurance usually will cover it. It just takes a referral for the most part. Go and have this checked. You go in, you get an easy ultrasound of your legs. An ultrasound does not hurt. And then if they find disease, the treatment really is very easy. Many people are scared, but you really don't have much feeling on the inside of your veins. So when they go to treat, it's something that you probably won't notice, or you'll feel a little bit of stinging and burning once in a while, but there's nothing like what you can imagine. The outcome is you finally have skinny ankles. You don't always have to wear the compression socks. You can get on an airplane and you can go to bed pain-free. You don't have to take a lot of medicine. And besides that, you don't develop all those varicose veins. You can get rid of a few of those. Your legs can stay pretty. If you're like me in your 50s and 60s, you still want to wear shorts once in a while. But you have all those varicosities and twisty-turny veins that are large. You can get rid of those. Many insurances, though, be cautious. Many insurances will not cover anything that is cosmetic. So if you are, using it just to get rid of the varicose veins and not treating the underlying medical condition, then most insurances will not pay for that. So just keep that in mind. Now, the other thing that is more dangerous than that, let's say you have this venous disease and swelling, and you get on an airplane, you'll sit or in a long car drive, you don't get up and walk around, then you can develop what's called a DVT, or deep venous thrombosis. So you develop a DVT, and with the DVT, that is a blood clot in the deep veins. When you develop a blood clot, deep venous like that, you can get up and walk. That clot can slip, and it can go up into your respiratory system, into your lungs, into your heart. And once that happens, then it blocks all blood flow, and it's immediately deadly. So it is immediately fatal. DVT is something that can steal many, many lives. I want to talk a little bit more about DVT, though, because there are more situations where this can occur. I've known, patients who have come in and said their family just all of a sudden, they were out fixing a car, they were out for a walk, they were just sitting in their chair watching TV, and just suddenly died. And that is, they had a swollen leg for a couple of weeks, maybe just one leg, a little aching in the calf. And this is where you may be developing a DVT. Once that slips, and again, it goes to the heart or to the lungs, it is immediately fatal. Another thing that you're at risk for, if you take birth control pills, if you have a surgery, especially a gynecological surgery, so, you have a hysterectomy or some sort of a GYN surgery, or if you go through an orthopedic surgery, so a knee replacement, hip replacement, a broken bone, getting a bone fixed and fixated, repaired, those are the types of surgeries and procedures that increase your risk of DVT. So it's very, very important for you to watch if you've had one of these procedures, or if you've been in a long car ride or on an airplane ride where you didn't get up and walk much and you notice some developing swelling in one leg. It's very, very important that you catch that. This is one of those things that most people really haven't, we really don't do a lot of education. There's a ton of education out there about heart disease and obesity. There's a ton of education about maybe asthma, many cancer. Many of those things get the highlights and the studies. But something that is just very, very important, seemingly very small, but extremely fatal is a DVT. And that comes with peripheral artery disease. So those are a few things that, if you can get some relief and get improvement in your swelling, improvement in your looks, improvement in pain, all of those things are definitely worth it. Again, you are your advocate. Go ask your doctor for these things. I don't find many people focus on that. When they come to see me, there's usually aches and pains. Usually we're going over their laboratory, talking about their weight or, of any of their other concerns that they can't sleep. The peripheral vascular disease takes a back seat. So I want to make sure that that is something that you can take care of and very easily. Some other things you can do, and I'll mention very briefly for restless leg. So if it's not peripheral venous disease, if it is just a magnesium deficiency, you can take magnesium. I've had a show on magnesium. Please go back and watch my show. That was with Robert, one of my great friends. We talked about a lot on magnesium and the different types that would help. So magnesium glycinate, magnesium threonate, those are two that you can try and might not give you stomach upset. The other thing that you can try too is magnesium lotions and baths. And, just try to instill maybe potassium, get that from your diet. Potassium pills don't work very well, but coming from your diet. So cantaloupe, almonds, and bananas are very, very good for increasing your potassium. If you take certain medications like Lasix, furosemide for your heart, that tends to get rid of potassium in your system, and that can cause some leg cramping at night. And that is another thing you can do is add that to it. If you're taking furosemide, your doctor should have you on potassium to benefit. If you're still having problems, then you need to let your doctor know. And of course, when I give you all this information, especially about supplements, especially about medications, please check with your provider. Make sure that this is something that you can do and do safely. And they might have a better idea always. So please check with your doctor that you know and trust very well. So in a minute, I want to bring back and talk about the second thing that's very important to our, to our legs and in our arms and our body, and that is peripheral artery disease. But first, you guys, I want you to go back and look through some of my shows. I've been doing this for about 3 years. I've had a lot of great guests to talk about mold toxicity, to talk about weight loss and some of the new medications that are out there. We talked about dementia and Alzheimer's, a lot about heart disease. So please go to my website, drpbetterlife.com, and you can catch links to the YouTube channel. You can catch links to the Better Life with Dr. Pinkston on iTunes and Spotify and iHeart Radio. I'm on every platform, so go take a look, and I appreciate that. I also want to tell you a little bit about my sponsor, Magna Pharmaceuticals. I've had Dr. Lesser on, who's talked about they've got a good product called Nufolip, which is great for neuropathy, if neuropathy is what you're suffering. And they also have a good B12, methylated B12, and methylfolate. Again, please go to drpbetterlife.com. You can find out more information about them. You can also go back and watch those shows. I'm going to take a short break and be back, and I'll talk about peripheral vascular disease.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Hi, everybody. Welcome back. I am Dr. Marianne Pinkston, talking a little bit today about peripheral vascular disease. And now I want to move in a little bit to peripheral artery disease. Let me give us a quick recap in case you've just joined us. That peripheral venous disease are the veins in the leg. So when arteries carry blood flow down to the feet, your veins carry the blood flow back up to your heart, but they go against gravity. And that is an issue of a lot of swelling and aching and difficulty, with neurological disease and pain at night. Peripheral artery disease is a little bit different. So peripheral artery disease is, if you look at people who have cardiovascular disease, have high cholesterol, diabetes, who smoke, don't exercise, overweight, these are people that begin to have cholesterol that build up in the heart, and then also cholesterol building up in the arteries of the neck, the carotid artery in the neck. And this puts people at high risk for heart attacks and stroke. But did you know that you can actually get cholesterol built up in the arteries of your liver, in the arteries of your kidney, and then in the arteries that go to your arms and legs, mostly to your legs? So cholesterol buildup, when it starts to build up inside of the artery, then it begins to block the artery. Blood flow that comes from the heart down to the feet cannot get into the feet. So people, as they get a little older, will begin to have aching legs when they walk. So peripheral venous disease, we talked about having aching in their legs at night when they're at rest. People with peripheral artery disease can have pain when they're up and exercising and walking. So if you get up to go walk outside and go to your mailbox and you start getting, bad cramping in your leg, painful enough that you have to sit and rest, that resolves it. And then you get up and go about the same distance, and that happens again. So if it happens in the grocery store, you're on your walk with your dog, going to the mailbox, etc., then you are probably having experiencing a clogged artery that is in the legs, and that is from cholesterol. The other things that you will notice is lack of hair growth on the leg. So I was standing in the elevator the other day, and a man came on with shorts, and I noticed he had, a good hair growth on his upper legs, but then he got to below his knee, and he had absolutely no hair whatsoever. And that is what I call an elevator diagnosis. I know that the man has poor blood flow into his lower legs and probably has peripheral artery disease. When you have peripheral artery disease, you have to know you also have cardiovascular disease. You also are at risk for a heart attack and a stroke. Many men also experience erectile dysfunction. Most of the time, that is the first symptom of cardiovascular disease, is to have erectile dysfunction, because that's an artery and it fills with blood. And if you're developing artery disease, then it no longer functions well, fills with blood. So you have a difficulty getting or maintaining an erection. So all these are symptoms leading up, and those risk factors are poor diet. First of all, family history. So take a look at your family. If the peripheral artery disease happened in the family, or heart attacks or strokes or other difficulties with, developing of heart illnesses or cardiovascular illnesses, then if you're overweight, if you have diabetes or hypertension that coexists, if you are a smoker, if you intake a lot of bad foods and alcohol and just poor living in general, lack of exercise, those are things that can lead to an increased risk of peripheral artery disease. So how do you, if you've discovered the symptoms, that you see little hair growth, you have aching in your legs, especially when you're up and walking, maybe you notice that the nails on your feet don't grow quite as well. Maybe you have an ulcer on your leg that isn't healing very well. It's because there's minus blood flow in that area. You don't get your oxygen, you don't get your nutrients to your legs, therefore your toenails don't grow, the hair doesn't grow. Those are just the leading signs. Once you begin to have enough claudication there, claudication is what they call it, and enough pain there, you're in danger of possibly losing a leg. So that's another area where you need to be cautious and make sure that you seek care with your doctor. But your doctor should also consider that you have cholesterol disease, cardiovascular disease, and focus on that as well. So what happens? So you go to a peripheral artery, vascular surgeon, somebody who manages their the arteries, and you can get a test to see if you have it. It's called an ABI, or arteriobrachial index. It basically takes the blood pressure of your legs and compare it to your blood pressure in upper body. And if you have a general lower score, then you have peripheral artery disease. So it's very easy to catch. Even your primary care doctor can do it if they do this type of testing in-house, but aciobrachial index. Then you can also, they can look if you're having a low score and you're at risk, then you can get MRI that looks at the arterial flow of the arteries all over, actually, but into the legs. And then if you do have enough of a clot there of cholesterol or buildup, then they can do what's called the arteriogram to look at that. Then they'll do an angioplasty. So an angioplasty is much like a catheterization of the heart, but this is of the legs. They can just go in and take a look and remove. You can have surgery, and you can have some of that buildup removed if you have a healthy enough arterial system that would benefit removal, and you're active enough and not too old and not too incapable of taking care of yourself long term, then you can actually have this taken care of and reversed. So the majority of people, though, really need to work on the side of prevention. So with prevention, we are looking at, first of all, family history, looking at eating, much better, and exercising, stopping smoking, limiting alcohol, definitely increase of exercise. It would be the thing that I'd focus on the most. And your diet as well. Many doctors will, if they know that you have the buildup beginning in your arteries, they would put you on a statin medication. Statin medications, you know how I feel about them. I think there are situations where statin medications are important and can help, especially if you take the right type of vitamin supplements on the other side to make up for what you lose when you take a statin. But there are other ways of treating your cardiovascular health and treating your cholesterol. Red yeast rice is very similar to us, and it's more of a natural statin. And there are other vitamins and minerals and things that you can use and, to try to reduce your cholesterol and improve over time. But be sure and have your cholesterol checked yearly. If you do have high cholesterol in your 30s, begin to look your way forward. heart disease, peripheral artery disease, all these diseases, they start way back in your teens, 20s, 30s. This is something that you begin to pay for as you get older. It's not something that you can live with and enjoy, your foods and your way of life any way you want up until about 40 or 50 and then suddenly change. This is something that starts early. So please encourage your kids to take a look at their health and get started there while you're in college, while you're, taking care of you and having your children and your young families. This is the time to get on it, especially if you have a family history. So I want to invite you guys to please go back and look through some of my older shows at drpbetterlife.com. I talk about hormones. I talk about GI health. I talk about not only hormones for women and menopause, but hormones for women who have PCOS. I call that estrogen dominance. There are many, many topics back there. I would love for you to go take a look at and take a look at my sponsor pages too. So Magnum Pharmaceuticals is my sponsor today, who has helped me out greatly. He's got a lot of great shows back there as well. So if you guys will go back and take a look. Thank you very much for listening, and we will catch you next time.
You've been enjoying The Better Life with Dr. Mary Ann Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.